Hello there. Let's talk about anxiety disorders, shall we? Anxiety disorders, as you saw from the videos, are the most common mental illness in the United States. So many people are affected from anxiety disorders. We're talking about 40 million adults in the United States age 18 and older. That's almost 20% or 1/5 of the U.S. population that are caused by problems that they have dealing with anxiety. You know how much it costs? More than $42 billion a year to deal with people being stressed out. Why, that doesn't seem fair. That's almost 1/3 of the country's total mental health bill, now does it? Let's look at some of the generalized or the types of anxiety disorders, okay? We'll break that down, draw a big old line right across here. Generalized anxiety disorder, okay? What are the big things about generalized anxiety disorder? We will look at these in more detail on following slides, but one of the main things in here is that women are twice as likely to be affected than men, okay? We'll get back into that. There's also, I would have to put in here, one of the main things is greater than 6 months or more, okay? That's a greater than sign. Obsessive-Compulsive Disorder. Equally common among men and women. There's a few of these that are equally common among men and women. 1/3 of affected adults first experience symptoms in childhood. Okay? OCD. Everybody's heard of that before, which is really CDO, so that it is in order, right? But OCD. We'll get back into that in another slide here, but that's the main things on there. That's not the main things on there. The main things on there that we want to put is what? Talking about, you have an obsession, and that obsession leads to a compulsion to do something. Okay? You have to do something to take care of that obsession. Panic disorder. Again, quite a few people with panic disorders. Again, women twice as likely to be affected by men. And it's very, very highly correlated with major depression. So major depression and panic disorders tend to go along together. Post-traumatic stress disorder. Okay, that is a lot of people, 7.7 million. Okay, interestingly enough, historically women are more likely to be affected than men. You would think that maybe because of wars or something like that, that men would be, but there is unfortunate correlation between childhood sexual abuse and developing PTSD later in life. Social anxiety disorder. Wow, that like doubles everything else almost so far, and it's also equally common among men and women. Again, we'll talk about that more in a minute. Specific phobias, as in scared of specific things like doctors or spiders or whatever, is by far the biggest category. 19 million people affected by that, and again, you have the women with twice as likely to be affected as men on that particular thing. Let's look first at more detail in generalized anxiety disorder. Okay, the key here is, well, there's a couple key here. One is chronic. Okay, it has to be chronic, and we like to say over 6 months in time, how long you have to be suffering from this problem of having anxiety. Okay, now it's focusing on real life issues. Okay, the issues such as work problems or finances or relationships or health or what have you, they are real life issues, things that people deal with. Okay, you could even put in their tests or exams or something like that, and that's fine. But they have to be something that is actually happening. Okay. okay? And they're happening, and the problem is they have anxiety about them for a long period of time, again, more than 6 months. Okay, so you'll hear patients say, I can't stop worrying. I'm constantly getting tension headaches. I'm constantly getting tense in my muscles. Body hurts. I grind my teeth at night when I try to sleep. Okay? It happens for a long, long period of time. Everybody gets a little bit anxious or stressed for short periods. This, again, real life problems for a real long time kind of begs the question, could you have generalized anxiety disorder if you just happen to have a very high stress job? I would have to say sure, because you could have a very high stress job or and that would make you worry about finances, and maybe you're having to work too many hours every week, and it's running into your relationships, and it's running into problems with bad health because of all of that, and bad eating and stress, and you know. So I mean, a high stress job certainly could be account for a generalized anxiety disorder. What's the treatment for that? Well, quit your job. Find another job if you can, right? Okay. So, what are we still looking at? We are looking at the signs and symptoms of generalized anxiety disorder. Okay, again, it's more or less the same symptoms that you saw before, right? You have increased heart rate, you have shortness of breath, you're shaky. You're basically having a kind of a panic attack, but over a long period of time. Okay? You just can't stop it. Alrighty? Testing. Well, you pretty much have to just kind of go clinical and find out what's going on with the person, and talk to them about that and find out, you know, is there anything specific, or is it pretty much everything in their life that's kind of gone down the tubes and stressing them out for a long period of time. Okay, you need to rule out some of these physical causes, because as you have seen, the increased heart rate, shortness of breath, shakiness, these are all kind of like increased metabolism things, right? And you think about that, well, that's the same thing we had in pheochromocytoma and hyperthyroidism now, isn't it? So there may actually be some physical problems that look a lot like generalized anxiety disorder, or you may have some of these physical problems that will kind of set you off, and you may or may not have a physical problem anymore, but you still have the generalized anxiety disorder. Either way, you have to worry about these pheochromocytomas and hyperthyroid. You just don't find somebody that seems like he's really stressed out for a long time and say he has generalized anxiety disorder, if in fact there is a medical problem that you can deal with immediately and possibly save a person's life. OCD. Okay. Everybody's heard of OCD. Recurrent, as in something is happening over and over and over and over again, right? If you have OCD, this has been driving you crazy this entire time that I've been drawing these crooked little lines and all that sorts of things, right? Well, now you have these unwanted, they can't be wanted thoughts, they have to be unwanted thoughts that literally kind of haunt you. And that's why it's an obsession, okay? You can only get rid of them by doing something that you are compelled to do. So a repeated behavior that you are compelled to do, and that's what we call the compulsions. So here we go. I might get AIDS from germs on the doorknob, so the patient cleans the doorknob in the house 2 times a day. Okay, that's a pretty minor form of OCD if you ask me, but there you have it. It does meet the criteria, right? It's recurrent. You keep thinking that you might get AIDS from the doorknob, and because of that, you have to repeat a behavior, like clean the doorknobs in the house twice a day, or you're compelled to do that. Signs and symptoms, again, unwanted thoughts or images for that matter, okay? You have to relieve these unwanted thoughts or images with rituals by doing something to get rid of them, okay? There does seem to be a family correlation there. Again, testing. Most of these, you're going to want to do the same thing. You're going to rule out any kind of physical problem, and you're going to just want to sit down with the person and find out what is exactly wrong with them. Okay? So OCD, probably not anything new to you, but you're going to have repetitive things that you have to do to alleviate the problem. Now let's look at panic disorders. Okay? Panic disorders, you don't expect them to happen. Okay? And they aren't provoked. This is intense fear accompanied by actual physical symptoms, okay, such as you're having chest pain, your heart's jumping out of your chest, maybe you're short of breath, you're dizzy, maybe your stomach is really upset, and there's a lot of people that suffer from this, okay? They say, what, 20% of Americans will suffer from this at least once in their lifetime. Let's look specifically here at agoraphobia, okay? Agoraphobia is certainly can manifest as a panic disorder. It is certainly an anxiety, a state of anxiety, but this is a patient who is afraid of being in a place where no help is around. Now you would think that would mean that they would be afraid to be by themselves, but that's not the case now, is it? The problem here is they have afraid of being in a place, usually outdoors, where no one is around. Go even further, maybe outdoors and in a crowd where no one is around to help. Now, that seems kind of like nonsense a little bit, doesn't it? Because you would think if you were outdoors in a crowd, somebody would always be around to help. But that's the problem. It is a disorder. It doesn't make sense. Okay? Now, it could have been brought on by an original panic attack long time ago, or maybe you were out there in the grocery store and you had a panic attack about something, and then now you have agoraphobia and you haven't left your house in the last year. Okay? These are starting to look familiar, these signs and symptoms, aren't they? Got your chest pain, your numbness, your tingling, as in some kind of nerve problems thing going on there. You're like, what? But there's nothing real. Yeah, but you can still get these physical manifestations, right? Hyperventilating, and you feel like, oh man, it's all going to end. The world is ending. You got the impending doom thing going on here, right? So you're literally just kind of having all of these physical symptoms like you actually do have something that's going to kill you. Okay? Well, these look familiar. Clinical, rule out physical disorders, because you may just be having a panic attack because you got pheochromocytoma or hyperthyroid or something. Post-traumatic stress disorder. Okay, again, very, very commonly known about PTSD, and there had to be something that was caused or threatened harm. Okay, so the big ones, war, rape, natural disaster, car, plane crash. It is normal to have problems dealing with that, right? It is normal to have anxiety after these kind of events, of course, but eventually these symptoms should subside. That's the key right there. Eventually these symptoms should subside. Now, if it is 5 years later and you're still having these flashbacks that you would have in these, or a recurrence of event and associated symptoms, then that's a problem, isn't it? Okay? No matter what it is, many years later, you should not be reliving that event over and over again, along with the whole difficulty sleeping and shaking and basically having a panic attack over the same thing over and over again years later. Okay? And of course, you have, social difficulties sometimes, sleeping difficulties frequent from nightmares. Okay, well, same thing, testing clinical, rule out physical disorder. Again, there could be something that's simply stressing the person out and triggering these bad experiences. Okay, social phobia, severe anxiety in social situations. Now, we're not talking just a little bit. Nobody, well, not nobody, but most people don't like to stand in front of a crowd and talk, right? Excessive fear of having others watch and judge their actions. Okay, speaking, eating, writing, working, anything in front of others, using public restrooms, talking on the phone. This is a lot more than just typical teenage stuff. You find any teenage boy, for example, and they're going to have some problems with doing this in front of people. They're thinking everybody's watching them and judging what they're doing, and the reality is nobody really cares. But again, it's a disorder, right? And of course, you get the whole stress response that runs into the same kind of signs and symptoms, doesn't it? Sweating, nausea, vomiting, all that sort of thing, high blood pressure. Okay, testing again, exact same as it always was. Well, most of the problems we're going to try to treat with cognitive behavioral therapy. That's where you sit there and you talk to the shrink and try to work out the problems and deal with it without medicine. However, you may have to go with some of these medicines for anxiety. So we have something for example, generalized anxiety disorder. You go with buspirone. Okay, it's pretty safe as far as drugs go. The benzodiazepines, on the other hand, they're pretty not only addictive, but they make you really, really tired. Okay. Buspirone, on the other hand, it will take the edge off, but it doesn't actually eliminate anxiety. Okay, so there are some give and takes with the power of the medicines. Okay, the benzodiazepines, they usually work pretty fast, and they get rid of it pretty fast, of the problem, of the panic attack, the anxiety, whatever. Okay, well, of course, anything that works really well is also going to have serious drawbacks. That's just kind of how the thing works, and part of it is dependence. They are pretty darn easy after a few weeks to get hooked on them. Okay, you can get addicted to them. So you don't want to be taking any of these benzodiazepines, Xanax, anything like that for any period of time. Antidepressants, okay, these are a lot safer, right? And you would try to use them in the general anxiety disorders first, if you can get away with it. Okay, it does take a while though to have antidepressants get in your system and build up enough medicine in the blood. It can take up to 6 weeks, and that's pretty typical. The problem is during that 6 weeks, before it's all built up, it does still mess with your emotions a little bit, and you may end up getting even more depressed. Okay? Some of these antidepressants will cause you even more sleep problems and cause nausea. Okay? SSRIs are the old faithful nowadays, aren't they? That's your Prozac and things like that. The SSRIs are pretty good as far as handling most problems. Okay, but again, they're over a long period of time, and it's not nearly as powerful as some of these other ones. Okay, how do the SSRIs work? Well, if this is your nerve ending, and neurotransmitters come out of the nerve ending, and then they go to whatever organ of your body they're going to, say the brain, for example, the serotonin comes out of that nerve end. It's a neurotransmitter, and the serotonin is the drug that basically it just calms you down. You're like, oh, that's nice. That's a really bad nice thing, right? Anyway, it just kind of calms you down. They say serotonin is kind of like if you decide you're going to end it all one day and jump off a roof. That's the thing that's going to keep you on there. It's going to kind of restrain you a little bit. Okay, so SSRIs, they literally say that. They are selective for serotonin, these medicines, and they inhibit the reuptake. Okay, so if serotonin is running around in this cleft and trying to get into its end organ, like the brain, and it goes in its little receptors. Well, once it's done what it's supposed to do, the serotonin jumps right back out, and then normally it'll be reuptook, or taken from the cleft in between that nerve and the end organ and shoved back in here so that it can be used again later. Well, all the SSRIs do is they make it so that whatever is taking that and putting it back in here can't do it. So it just stays out there a long time. That's all that means. Reuptake inhibitors. Okay. Obviously, we should be doing case studies, and we want to try to change it a little bit on making a case study, giving it to somebody else instead of presenting it, and then talking about it after that. So that ends our Mod 9 Anxiety and Nervousness module.